Gutierrez here. I'm in Dallas, Texas, and what I want to do is talk to you about spinal decompression therapy and what it's good for. Okay, so first of all, spinal decompression can help with different elements. It can help with a herniated disc, a bulging disc, sciatica pain, stenosis, many different things. But the thing is, if the doctor has to figure out if you're qualified for it and if you're going to get good results from it. But what I really want to get into is how it works and why it may be needed. Okay, so one of the things I kind of want to break down is the anatomy of the spine. So if we look at the spine here, this is as if I'm here. This is my spine here, and then so what we're looking at is there's 24 vertebrae in the spine. Each of these joints move. That movement helps to bring fluid in and out of the joints. We also have our nerves here. Over time, what can happen is there can be damage done to the disc to where it starts to protrude and come out to where it's either putting pressure on the spinal nerve or the spinal cord, and this can cause excruciating pain, a lot of pain actually. It can also cause numbness, tingling, and so forth. But what happens when you have a herniated disc is that we got to take into consideration that the disc is essentially, like a sponge filled with water. So what happens if you have a herniated disc, it begins to crush and compress, and then it starts to bulge. But the big problem is that there's many ligaments that surround the joint, and all of these ligaments actually shorten over time with that disc as it compresses, and they lose flexibility. So this I'm just kind of setting you up for the beauty of what decompression therapy is. Okay, so go ahead and come into this image here. What we're going to do. So this is the same thing. This is a small segment out of the spine, and this is going to demonstrate what happens over time whenever you're developing a herniated disc. So as I move this way, we can see that the disc collapses, and then it gets to a point where it starts putting pressure on your spinal nerves there. That is a herniated disc that's causing pain. And again, it could be back pain, sciatica, numbness, tingling, weakness, things like that. And again, if we remember that the disc is full of fluid, it's compressing and losing fluid over time. It's losing height. The ligaments are shortening over time. Many surgeons would look at something like this and think that you would need surgery. We're going to go in there and cut that out. Well, let me tell you, the beauty of spinal decompression is that spinal decompression is able to reverse a lot of these damaging properties in a herniated disc. And let me demonstrate how. So what happens is, spinal decompression takes that, those segments that are needed and applies traction in the opposite direction, okay? And then over time, what we're able to do is bring more fluid into the disc, regain flexibility in the ligaments that surround the disc, create more movement in the segment, which is also going to give the disc more hydration and more nutritional properties, better health. This is also preventative of the disc getting worse. And then this is the beauty of spinal decompression. It is a breakthrough treatment. We do offer it here at Whole Health Partners in Dallas, Texas. If you are suffering with anything of this sort and you want to just get in for an evaluation to see if you're a qualified candidate for this, if you're trying to avoid surgery, just give us a call. You'll see all of our information below. Thanks, and have a good day.